Hi guys, welcome back to my channel. Welcome to today's video, which is going to be cutting versus bulking as a type 1 diabetic and how you can manage your blood sugars around these two different phases. Now, before we get going, just a big disclaimer, I am not a doctor or a medical professional or a personal trainer or anything like that. Everything that I am going to be telling you is all based on my own personal experience and my personal research and what has worked well for me. So any changes to your diabetes management should obviously always be done in conjunction with your diabetes team. But with that out of the way, let's get this video started. So this video actually came about from a request over on Instagram. If you're not following me over there already, you can go and do that at Diabetic Becky Fitness. And the request was asking me to give my insight on managing a bulk as a type 1 diabetic and specifically eating high carb and needing lots of insulin and how to manage that. So I will get this video started with bulk first. So the very first thing that's super important whenever you're going into a new phase of training or new phase of eating, like going into a bulk, is to track absolutely everything, and I mean everything, for the first 1 to 2 weeks. So things you want to be noticing and taking a note of are obviously your blood glucose, and you want to be doing this at least hourly. Any food you're eating and including the whole macronutrient breakdown, so not just carbs but also protein and fats. Obviously your training session, not just the times that you've trained, but also what type of training session you're doing and the intensity, as well keeping a close eye on blood sugars during that training session, so before, during and after the training session. Any light exercise you're doing, like walking, you want to be making a note of your pre-bolus times, so how long before eating are you doing your injection, what carb ratio are you using to calculate that insulin dosage, what insulin you already have on board, and what are you going to be doing for the next 3-ish hours after injecting, because that's roughly how long fast-acting insulin lasts in most people's systems. And anything else you think of that could be affecting your blood sugars, like for example if you are a woman, where you are in your menstrual cycle. And the easiest way to track all of this realistically is to be doing a spreadsheet, and a lot of this I have learned thanks to my amazing diabetes coach Talia, and I will leave her Instagram handle down below in the description box if that is something you think you might benefit from. But using a spreadsheet to track all of this is absolutely vital, because you are going to need to, if you're really serious about doing a good bulk, getting the maximum rewards out of it, you need to manage your blood sugars as best as possible. And this first 1 to 2 weeks is what is going to set you up to then make the whole rest of it so much easier. So tracking like that meticulously is going to be really important, especially because when you are bulking, obviously you're going to be eating a lot, which means more insulin. So you really need to know exactly how much insulin you want to be taking every time you eat, based on all of these different factors. It's really key, especially when you are bulking, to have your carb ratios completely nailed, so that then you can know what percentage you need to increase or decrease your insulin doses based on what kind of session you're having, because an upper body, for example, session may have a much different effect than a lower body session, because of different intensities, different amounts of energy burned, different amounts of adrenaline and stress hormones released into your body, which could all affect your blood sugars, which is why you want to be keeping such a meticulous spreadsheet, so that you can then see how all of these different factors affect your blood sugar, and then going from then forward, you can pinpoint exactly when your insulin sensitivity starts to either increase or decrease based on different sessions, before session, during session and after session, and you can then manipulate your insulin accordingly. So for example, you may need more insulin before an upper body session and then less insulin after an upper body session, and it could be the complete reverse for a leg session. It completely depends how you personally respond, your hormone response, your energy expenditure, so you need to track this for yourself. After you've got these carb ratios nailed down, it's time to kind of focus in on the smaller details. So one thing you will want to keep a close eye on is your pre-bolus timings. Like I said earlier, that's how long before eating you are doing your injection, because this can really vary based on time of day and also your activity level. So as a personal example, for breakfast, for me, if it's on a training day, I eat after training. I have a snack before training, but my main breakfast is after training, and I only need to leave a 5-minute pre-bolus timing between injection and then eating. Whereas if that's a rest day, I need to leave 25 to 30 minutes before eating after injecting to avoid having a post-meal blood sugar spike. So that's why it's really important to note down all of these factors, because maybe you're seeing lows and then highs, or highs and then lows, and it might not be your carb ratio, it may be your insulin timing. So when you're eating a lot on a bulk, it's really important to look at all of these factors. Another thing you may find if you're moving towards a bulk and eating more, especially if you're someone like me who has an incredibly slow digestion, splitting your bolus dose may be something that you need to look into. Now, this won't be for everyone, so you're going to have to obviously analyze your own blood sugars. But because you're eating a huge volume, obviously it's not all going to get digested like that. It's going to take a little while to digest, and therefore for the sugar to get into your bloodstream and affect your blood sugar levels. So personally, what I have to do on a training day, for example, in the evening, I actually only have 70% of my total bolus dose before I eat, and I have the other 30% after I eat, after those carbs have been digested and the glucose has gotten into my system. Now, like I said, this won't be for everyone, and it may be that you have to have some before and then some only half an hour later, or some an hour and a half later. So that's why it's really important to really focus on the timings of all of your blood sugar changes, because for me, I've got it down now. I know that roughly an hour to an hour and a half after eating is when I take my second dose. But if you are experiencing hypos immediately after eating and then highs hours later without noticing any major factors that are influencing that, it could be that you are having a slow digestion and that you do need to split your dose, especially if you're having a big bulky meal with lots of carbs. Splitting your dose could be the answer. Another reason for this to be happening, so having hypos after eating and then highs later, could be your digestion of protein and fats, because protein and fat can also be broken down into glucose and then obviously affect your blood sugar levels. And this is more likely, obviously, the more you're eating of them. And if you're on a bulk, it's likely that to up your calories and get in enough calories, you're probably going to be eating a fair amount of fat. And if you're trying to put on muscle, obviously also a lot of protein. So in the spreadsheet, that's why you want to be tracking your whole macronutrient breakdown, not just your carbs. So you can analyze different high fat meals, high protein meals, high carb meals, and see not just how much they increase your blood sugar, but over what kind of time frame. So it's likely that a high carb, lower fat or lower protein meal is going to spike your blood sugar quicker than, for example, a lower carb and a high fat meal. And you may need to be injecting for more than just the carbs. You may need a second dose for your fat or your protein, which is being digested later. So you are going to have to analyze your own data and obviously work in collaboration with your diabetes team, like I always say, to work out what percentage of fat and what percentage of protein you need to be taking an insulin dose for, because your fat and protein insulin ratios are not going to be the same as your carb ratios. So for example, what a lot of people like to start with is taking 40% of your fat and injecting for this as if it were carbs. So for example, let's say, just to keep the numbers easy, you're having a meal and your carb ratio is 1 unit of insulin to 10 grams of carbs, and in this meal you have 100 grams of fat. So you take 40% of that, which would be 40 grams of fat, you would treat it as if it were carbs, and then 1 unit to 10 grams of carb means 4 units for your 40 grams of carbs, which are fat. But like I said, it's not going to be 40% for everyone, and fat and protein can also have different ratios from each other. So maybe you have 30% of your protein you insulin for as carbs and 40% of your fat, but it's going to take a little bit of trial and error and again, a lot of analysis. Like I said as well, fat and protein will tend to be converted to glucose later than your carbs. So you may find that you're needing to do a second insulin injection after eating or a bit later on to account for your fat and your protein. If you are one of those people like me who has to split your insulin dose anyway, it may be that you add this fat and protein insulin onto your second dose after eating. Or if you're not having to split dose for kind of a carb heavy meal, you may just have to split dose if you're having a high fat meal. So for example, you take your insulin for your carbs before you eat with your normal pre-bolus times, and then after eating, you then take that second injection for your fat and protein. But this is where the magical spreadsheet comes in so helpful, because I've obviously explained a lot of things that you need to be tracking and a lot of things that can influence your blood sugars. And it may be that you try something and it doesn't work, and it may be that it's not the technique that doesn't work, but it's the timings that don't work. Say for example, you tried splitting your dose and it didn't work, you have a high blood sugar, but maybe you just need to bring that other dose further forwards rather than increasing the amount of insulin you're taking. So you need to take a look at your trends when you're rising, when you're falling, not just your blood sugar in that moment. There is a chance as well that to cope with all of this extra food, you may need to increase your basal insulin rates, especially overnight as you are digesting everything that you've got left over from the day. If you've gone from a cut or from maintenance and you've increased your calories and your carbs and your fat and your protein by a lot, it's likely that this will continue to digest obviously overnight, and you may need more basal insulin. But again, it's all going to be very individual, so you're going to have to closely monitor yourself, work in conjunction with your diabetes team, and work out when you need to tweak your basal insulin rates. And another thing that can be causing high blood sugars if you are experiencing them on a bulk is dehydration. Now, dehydration can affect your blood sugars all of the time, but if you are on a bulk and you're eating a lot, there's a lot of insulin going through your system. You're going to want to make sure you're really hydrated so that the insulin can work effectively, efficiently, and you can keep your blood glucose stable. There's nothing worse than having a high blood sugar and it's just because you haven't drunk enough. Equally, if you have a high blood sugar, getting some sugar-free liquids in your system will bring it down a lot quicker than if you just take insulin without having that added aspect of hydration. I do have a whole video about faster ways to help bring your blood sugar down if your insulin is being a bit stubborn, so go and check that out if you think that is something you are struggling with. Okay, so that is everything to do with a bulk. Obviously, more insulin, more food, more movement, lots of things to take into consideration, which is why the spreadsheet is really helpful. But equally for a cut, if you're moving into a cut and it's a new period of your training or a new period of your programming, again, you're going to want to do that same spreadsheet because your insulin needs are likely going to change. One thing that could occur is that you need to have less basal insulin again and reduce it back down because you're going to be having fewer calories, fewer carbs, fewer fats, everything like that, and so your body's not going to be digesting as much, not going to be converting as much food into glucose, and so you may need to change your basal rates, which is why it's really important to do these spreadsheets anytime you move over. And it's not just basal rates, you could find that you need different bolus rates between going from cutting to bulking because the food you eat is going to be treated slightly differently by your body depending on what kind of phase you're in. So like I keep saying, analysis and tracking is your best friend. With a cut as well, it's likely you're going to be increasing your NEAT or your light exercise movements like walking, and so it's really important that you have a plan in place for your own blood sugars when you walk. Because for me, I find that doing any kind of walking dramatically reduces my blood sugar, and so I either need to reduce my bolus dose for a meal that I have before a walk, or if I'm not eating a meal before I go on a long walk, I need to eat some carbohydrates, and by long, I mean anything more than 30 minutes realistically for me. Now this is going to be different for everyone, like I keep saying, but you need to make sure that you know how a walk affects your blood sugar at different times of the day, and also the difference between a rest day walk and a training day walk, because the effects of your exercise are going to continue long after your training session, and so will affect how your blood sugars react to any kind of movement or anything for the rest of that day. So you need to have different plans based for a walk, even just for a little walk, based on what kind of day you are having. And on that note of walks making me low, hypos can be a real pain when you are doing a cut, and for the first initial transition into a cut, it's likely that you will have a few hypos as you readjust your insulin rate. Obviously, if you're on a cut, you're trying to reduce the extra calories that you have to have for hypos, and so finding low calorie hypo snacks can be really helpful. I personally really like Alpen bars, or like Benefit bars are the Aldi cheap alternative. They have around like 70 calories per bar and 10 grams of carb, which is exactly what I need to treat a hypo. Also, Snacker Jack rice cakes have very similar macros and are really helpful to keep around the house. For your quick burst of sugar, something like dextro tabs or gluco tabs, really minimal calories. They're literally pretty much just flavored sugar, and so there's nothing extra that's going to be adding calories to them, and really good to get your blood sugar up quickly. Then have your long-acting carbs as a cereal bar or a rice cake or whatever works for you. But these are some options that I really like, and I will leave links in the description box to dextro tabs and gluco tabs that I like to use. But like I said, if you are tracking macros on a cut, Please don't let yourself get frustrated if hypos are pushing you over your macro limits for one day or messing up your plan for that day, because like I said, especially in the first few weeks, it's probably going to happen quite a lot. And equally, if you have low calorie hypo snacks, it's not going to have that much of an effect on your overall calorie count or macro count for the day. It's about making sustainable changes over a long period of time. So one day going slightly over realistically isn't going to make a difference. So please just give yourself grace, because especially during these periods of transition, it can be really hard to keep stable blood sugars and avoid those hypos. And it's really important to treat hypos and not just get in your head about your cut or your diet or whatever you're trying to do. During any period of transition, it's really hard, whether that's going from a cut to a bulk, or whether that's the seasons changing, or if you are a woman and it is your period hormones. These periods of transition are really hard and throw an extra spanner in the works, so just give yourself grace and treat yourself kindly. And that is it for this video. Everything that I think you need to know about doing a cut or a bulk as a type 1 diabetic. If you want to learn more specifically about managing your blood sugars around different forms of exercise like cardio, HIIT or weight training, I have a video all about that I will leave a link down below, and you can check that one out if that's something that you need help with. But yeah, other than that, that is it for this one. I hope you guys all have an amazing day, and I'll see you in the next one. Bye!